provider's order for Miss Charlene Knight, birthday 8/8/39. She's allergic to latex, penicillin, and betadine, and we're going to go ahead and insert a Foley catheter. Looks like she's been having urinary retention and she's unable to urinate. So I'm going to go ahead and insert her room and go ahead and perform hand hygiene. Hi, Mrs. Knight. My name's Lovely, and I'm going to be your student nurse today. Can I have your name and date of birth, please? Charlene Knight, 8/8/39, and it looks like you're allergic to penicillin, latex, and betadine. All right, I have a provider order here to insert a Foley catheter. Looks like you've been having urinary retention and you're unable to urinate. All right, I'm going to go ahead and assess your perineal area, okay? I'm going to go ahead and perform hand hygiene. Don on some gloves since I'm going to go ahead and touch your perineal area. Go ahead and take off the gloves, the sheets. All right, Miss Lynn, I'm going to go ahead and assess your perineal area, okay? I can visualize the meatus. There's no discharge. There's no lesions. If there was any discharge or lesion, I would go ahead and perform perineal care. All right, Miss Knight, I'm going to go ahead and palpate your bladder, okay? Do you have any discomfort? You do? All right, we're going to go ahead and proceed with the procedure, okay? All right, go ahead and exit out the room. Take off my gloves. Perform hand hygiene. All right, I'm going to go ahead and compare the Foley catheter with my provider's order. So 14 French catheter, Foley catheter, same thing with my provider order. It doesn't include anything that has latex, penicillin, or betadine. It's not expired. It's intact. I haven't been opened. My surface is dry. Looks like I'm ready to go. I'm going to go ahead and put my provider's order away and go ahead and start. I'm going to go ahead and open up my package. Go ahead and throw this away. All right, Mrs. Knight, I'm going to go ahead and put you in the correct position, okay? Go ahead and perform hand hygiene. Now I'm going to go ahead and open it with the flap away from me, to the left, to the right, and lastly the flap closest to me, making sure I maintain my 1-inch border. I'm going to go ahead and take my drape, holding it with the shiny side closest to me. I'm going to go ahead and step back. I'm going to go ahead and drape Mrs. Knight. All right. Now I'm going to go ahead and don my gloves. I already have some gloves over here, so I'm going to go ahead and use those. All right, I'm going to go ahead and use my non-dominant hand. Go ahead and take the cuff of the left one as well. All right, now I'm ready to go. I'm going to go ahead and I'm able to move my package around. Go ahead and put it around here, making sure I maintain my 1-inch border. Go ahead and open up my hydrogen peroxide. I'm going to go ahead and open up my lubricant. going to go ahead and take my syringe. If the manufacturer recommended, I would go ahead and inflate it and test my syringe. Now I'm going to go ahead and take the cap off and throw it away. Now I'm going ahead and tack this. It's 10 milliliters. The catheter can take 5 to 10 milliliters, and I'm going to go ahead and insert this onto the catheter. In here. Now I'm going to go ahead and take off the tip of my catheter, making sure that I keep it sterile. Now I'm going to go ahead and lubricate it. Now I'm ready to go. Don't necessarily need this. I'm going to go ahead and keep it here. I'm going to go ahead and go into the room. Alright, I'm going to go ahead. My non-dominant hand is now contaminated. I'm going to put it here, open up my labia. Now I'm going to clean the outer labia, inner labia, the middle labia, the outer labia, inner labia, and middle labia. Now that it's done, I can go ahead and throw this away. Now I'm going to go ahead and insert my catheter, holding it about 2 to 4 inches away from the tip and making sure that as I insert it, the tip of the catheter does not touch the labia or my hands. Going to insert it until I see urine. Okay, I see urine. Now I'm going to insert it 1 more inch. Now I'll go ahead and hold this with my contaminated hand. I'm going to insert 10 milliliters of sterile water. Now I'm going to tuck it and make sure it's in. It's in. Now I'm going to go ahead and take out the water. Now my sterile technique is completed. Now I would go ahead and attach this with the securement tool that's inside of the package to the inner tie. At the bifurcation, and then I would go ahead and connect this to the inside of the bell, not the bed rail, inside. And then, Ms. Knight, how did you go ahead, how was the procedure? I would go ahead and tell Ms. Knight that I'll come back and document her input and output, as well as her urine color, the odor, the consistency and amount, and I would go ahead and document how well she was able to resist the procedure. And the procedure, now I will go ahead and take off my gloves, perform hand hygiene.